you, Miss Mary. How you doing? My name is Kishma. I'm your CNA for today. So I am going to be cleaning your private area, your Peri-Care. So before I start, let me go ahead and wash my hands and then grab my supplies, okay? So my Peri-Care, this is my supplies. Usually, like I said, for the water still, you're going to need gloves. Always remember that. And then I'm also going to need a choke because I'm going to put in a private area wash. Okay, so I'm going to put these over here. Let me take all my supplies out because I need to catch water. Oh, there was a check here. Okay, so let me catch some water. I'll make sure the water temperature is good. Okay. Always make sure you put water in the basin. Always make sure you do that. And catching water. Okay. I'm testing the water to make sure it's at an accurate or good temperature for my resident. Miss Mary, can you do the same thing for me for test the water? Is that okay for you? Oh, yeah? Okay, great, thank you. Okay, so I am going to apply my gloves. So I'm going to put a towel over you for privacy, and I'm also going to put a check underneath you so that the bed don't get wet, okay? Because I'm going to be cleaning your private area. So I'm going to pull that blanket all the way down to below your knees. I'm going to put a towel over you, and I'm going to ask you to turn for me. So I'm going to bend your knees like usual, and then I'm going to ask you to hold on to the rail. And on 3, we're going to turn. 1, 2, 3. Okay. Thank you. So, let me grab my jug. Move the cool light from out the underway. Okay, so Miss Mary, make sure it's not wrinkled. On 3, 1, 2, 3, we're gonna come back. Okay, great. Thank you so much. Okay, so I am gonna pull her gown up. I need to have access to clean her private area. And so the evaluator can see I'm cleaning the private area. Okay. So I'm gonna do wash, rinse, dry. Okay. I'm gonna wet my first towel. I can open it up. Apply soap. Lather. Then I'm going to close it back up, and I'm going to create my 4 corners. And remember, I'm going to be cleaning down. So, side, flip, side, middle. Okay? That goes into the dirty laundry. I'm going to rinse, doing the same method. Clean there, clean the other side, fold, clean the middle. Okay, dirty area. I'm going to dry using the same method. Down, fold, next side, fold, then middle. Okay, that goes into the dirty laundry basket. Okay, so Miss Mary, I'm going to ask you to turn to the other side again. I'm going to clean your behind, okay? So if you can bend your knee for me. Okay, and then I'm going to have you hold on to the rails. 1, 2, 3, and we're going to turn, okay? So let me situate you so you can stay there so I can get access, okay? So I'm going to wet. I'm going to apply soap, lather, get my 4 corners. This one, you make sure that you're wiping away from the vagina. So butt cheek, fold, butt cheek, fold, middle. Okay? And this goes into the dirty laundry. I'm going to rinse. Same butt cheek, fold, butt cheek, fold, middle. Dirty laundry, and then we're gonna dry. Same concept, butt cheek, fold, butt cheek, fold, and middle. Okay. I always, at this point, because I know the chuck is there, I'm gonna remove the chuck, move it away from me. And I'm gonna have Miss Mary turn over. Miss Mary on 3, 1, 2, 3. Thank you so much. And cover her back. I'm going to also remove her privacy towel that goes into the laundry. I can just cover her up a little bit when I get her situated a little bit afterwards. So let's take this up. This goes into the dirty area. This goes into the trash. Of course, this goes into the toilet, rinse, toilet, dry. Trash, dirty area. Okay, so I didn't use this. Okay. So now I gotta remove my gloves. With that, you can put that into the dirty area in your clean area. You didn't use it. 2 fingers, trash. Wash my hands. Going back to Miss Mary, make sure Miss Mary is situated correctly. Make sure she's covered and she's good in bed. Miss Mary, here is your call light if you need to call me. Okay, I washed you up. I'm going to make sure that the bed is locked and it's in the lowest position. Miss Mary, if you need to give me a call, my skill is complete.